Dr. Margaret Harris joins us for more on the situation in Gaza. She's a spokesperson for the World Health Organization. Dr. Harris, thank you for joining us on the program today. Now, health workers have begun their polio vaccination drive on Sunday, that's today. How did it go?
It actually went really well, Sally. The reports I have from our teams is that there was a really good turn-up to many of the health facilities, which really shows how committed the parents, the caregivers are to protecting their kids from polio. Because, you know, it was a big ask. It's a scary thing to come to trust that the pause will hold, but it did hold. And we are very happy with how things have gone today.
Can you talk a little bit about the logistics involved in making sure enough children get the vaccine, you know, especially given that the roads and general infrastructure has been damaged and, you know, the security situation is pretty risky. How problematic has it been for health workers to get access to the regions and people that need it?
It's about as complex as it gets, because you're absolutely right. No roads, very little working, and very hard to find people, and also just to get the information out. And I'm really grateful to the media, who've done a fantastic job of letting people know what's going on as well. We've had mostly fixed sites because it's better for people to actually come to the site rather than trying to find people. But we also did have outreach teams to go tent to tent to those people who really couldn't make it to the sites. And it certainly shows with the fixed sites, we did have a big turn up. You know, we had queues. So people definitely want their children to be vaccinated. They understand how important it is. We just wish that this could just be the beginning of really building back the health system.
And of course, as we've heard, you know, the drive follows the first confirmed case of polio in 25 years in Gaza. We know how dire the conditions are there, but can you talk about these conditions, you know, and how they've allowed diseases to spread, but especially polio, given it's just so infectious?
Absolutely. You know, polio hasn't been in Gaza for 25 years. We have not had polio. And that's actually why we have to vaccinate all the kids under 10. Even though they have had the standard polio vaccination, they haven't had the vaccine against this particular strain because there just hasn't been polio in Gaza. In fact, the immunization levels, the childhood immunization levels in Gaza have been some of the best in the world. It's been a model because there really are very, very committed parents in Gaza who want to do everything for their children. But the destruction of the health system, it's extraordinary that just in 10 months you can completely undo all the good that's been done over decades. But simply destroying the water systems, destroying the sanitation systems, but also herding people closely together, and depriving them of all the basics of life, essentially provides the perfect system for all the viruses that plague us to do their level best to thrive in this circumstance. And we've seen the standard stuff, the diarrhea, the respiratory, the coughs and colds, but we're also seeing the less standard stuff like hepatitis, meningitis, and now something that wasn't there at all, polio.
All right, Dr. Margaret Harris, we'll have to leave it there. Really appreciate your time.
Thank you, Sally.